this is Dr. Manika Khanna, founder of Gordium IVF. We had recently been introduced to the needle-free injection system, NFIS, which was sent to us for a trial by Intas Pharmaceuticals, which always believes in innovation, and so does Gordium. So we always try to incorporate something which is innovative. We conducted this trial on about 10 patients so far. It's beautiful because the biggest fear patients have in IVF is of multiple needles pricking them for 10 to 12 days. So this is needle-free, pain-free. It's just a slight feeling you get when it is done. And we conducted the trial to assess the efficacy. And what we found was that our patients responded as per expectations. So the high responders responded accordingly, the normal responders responded within the normal range, and the poor responders responded accordingly. The egg quality that we received, the embryo quality that we made was at par with the Gordium standards, and few of the results have already come in which are at par with our success rates. So I would say that the delivery system of the injection is quite satisfactory and can be taken ahead on a larger scale. As far as patients are concerned, well, they are the happiest because this needle-free thing, takes more than half the phobia of IVF out of their minds. We've had some very happy patients who will speak for themselves. And as an expert with around 20 years of experience, I would say that it is a system which can be scaled at a higher level. Thank you.
मैं अगर आपसे पूछूं सर, बिकॉज क्या होता है जब भी कोई नई चीज आती है ना तो लोग हमेशा डरते हैं, ऑल्दो ये चीज उनका डर खत्म करने के लिए आई है, बट जब भी ट्राई करने की इंटरनेट आया था तब भी यार ये क्या आ गया वैसा क्वेश्चन रहता है. तो अभी इंटास इतनी बड़ी एक पूरी ट्रांसफॉर्मेशन लेके आया, मैं तो आई एम तो लाइक फोकसिंग ऑन इंटास अ लॉट बिकॉज आई एम वेरी हैप्पी कि अ कंपनी इज डूइंग सो मच. बट जब ये चीज हो रही है, आपके पास जब इंटास पहली बार आया होगा, पीपल मस्ट हैव कम टू यू कि दिस इज समथिंग दैट वी आर कमिंग अप विद, एक हम नीडल फ्री इंजेक्शन आईवीएफ के लिए लेके आ रहे हैं. व्हाट वाज योर रिस्पांस टू दैट? हाउ डिड यू फील अबाउट इट?
So it appeared very good, but ultimately proof of pudding is eating in it. So we have to do a study because जो भी कोई भी बोलता है, we have to ourselves do it with evidence and get convinced कि ये बरोबर है कि नहीं. So the first step is to do a study. And what does the study mean? कि हम patients के ऊपर ही administer करेंगे and we'll do all the blood levels to check कि ये product की efficacy पर कोई असर नहीं है.
ठीक है.
So that is what we have done, that we have tried on patients and we have to look at two things.
Okay.
एक efficacious है कि नहीं, so वो हमें blood levels और ultrasound के ऊपर हम जो monitor करके response देखते हैं, ये हम दोनों चीज़ बताते हैं कि ये efficacious है. सेकंड थिंग इज, हमने सोचा कि ये नीडल फ्री है तो पेशेंट को अच्छा लगेगा, बट वो जेन्युइनली है कि नहीं. सो देन वी नीड पेशेंट्स रिएक्शंस. तो पेशेंट्स आर आल्सो हैप्पी.
क्या रिएक्शन था जब
तो कैसे वो ना वाव फीलिंग है ना कि अगर इंजेक्शन की वक्त चला गया. सो एक साइड पर एफिकेशियस है, सो द डॉक्टर्स आर हैप्पी, पेशेंट्स आर हैप्पी बिकॉज नीडल नहीं है. So then it's a win-win situation for.
तो जब आपने फर्स्ट किया था तब when you did that with a patient, तो proper उसमें blood test में कि पहुंच गया है everything, and patients are also very
patients happy and the response is good, so both are happy with this.
Wow, I think
that is what is important.
Yeah.
Hi everyone, greetings from NCare IVF Center, Kannur, Kerala. I am here to share our experience using the needle-free injection device system, which is an innovative concept, innovative technology introduced into IVF practice by Intas Pharmaceuticals. We have collaborated with Intas Pharmaceuticals and we have conducted a trial in about 10 patients from our center using the drug delivery system, which is needle-free. You all know that the most fearful thing when somebody comes for an IVF is repeated injections and the pain of that injection. So if you take the history of IVF, when we started, it was a long protocol routinely in which the patient used to have almost like 1.5 months of injections. Later we came to short protocols, we could reduce the number of injections. Then innovative technology has come using the pen devices. Again, it reduced the burden on the patients. Now, Intas has come out with a new drug delivery system which is totally injection free. So we have tested in almost like we have conducted trial in almost 10 patients from our center. The initial results were very encouraging and very reassuring. Almost all patients, the response was very good as expected. According to their AMH and their ovarian reserve antral follicle count, during the scans, the response was in par with the older injection devices and the drug according to the dose given. Then during the final day of stimulation, the total number of dominant follicles were also like expected. Retrieval rate was in par with the other conventional injection system. Then total number of M2 sites, the fertilization rate and the embryo conversion rate and the blastocyst conversion rate was also almost in par with the conventional system. So I think it's a very innovative technique in which the patients can have lot of their pain and their burden. We can reduce the pain and the burden of the patient. Looking forward, I think this is going to be, when we think about a patient-friendly IVF.
I am Dr. Sabayan Shivadasan, Chairman and Managing Director, Sabayan Group of Hospitals, Kerala. We have tried this needle-free injection system, shortly called NFIS, in 10 of our patients, supplied by Intas Pharmaceuticals for the use of injecting Folisurge injection. The team had come to our hospital, stayed there for a few days and trained our nurses and successfully, and they were very comfortable with the training. The injection-free system was pain-free to the patients, and patients liked it very much because of the painless nature of the injection, and the outcome also in terms of embryo quality was good. We are yet to get the outcome in terms of pregnancy rate, etc.
Hi, I'm here to tell my experience regarding the needle-free injection. Recently, I had the opportunity to experience by giving needle-free injection by using needle-free device for the administration of Folisurge to our patients for ovarian stimulation. Initially, the patients were really very apprehensive. They were wondering how this drug will go inside. But after a few days and our proper counseling, they felt it very comfortable. Not only comfortable, they were really scared about the pain of the injections. Now they feel very comfortable, convenient, and other patients also started asking for these needle-free injections. And the same patients, they are asking for the same device for use of administration of other drugs also. I think this will make a turning point for the ovarian stimulation administration of injections for the IVF, and it will be a real benefit and help for the patients who are undergoing IVF. Thank you.